Hello everyone, welcome to GrowMed. Welcome to the session where we will discuss some important radiological images which are important for the FMG exam. Okay, so without wasting much time, let's start our discussion. So the first two images you can see here, these are the images of the rickets seen in the child with the rickets. So we know that rickets is a deficiency, weakness of bones due to deficiency of vitamin D. So PYQ important one. Recently in the January 2025, July 2025 exam, the question was asked on this rickets. So you can see here the X-ray. This is called as a geno valgus. Okay, geno valgus, the bone deformity. You can see here this deformity. This is seen due to the demineralization of the bones. The bones become weak, and in the wrist joint you can appreciate the features like splaying. This is the splaying, fraying and cupping. Fraying means a line. You can appreciate here this line. This is called as a fraying, and cupping of this bones. So due to the weak bones, this is the radiological findings in the rickets. Okay, then let's move to the next topic, that next image, that is the scurvy. This is seen in the vitamin C deficiency. Vitamin C deficiency causes the scurvy, and these are the manifestations. So in the scurvy you can see here these rings. So these two rings, these are called as a Wimberger ring. You can also appreciate here these a line like this one. This line is called as the white line of Frankel. Okay, and then here you can appreciate a spur like this. This spur is called as the Pelkin spur. This image is quite easier to recognize if at all this is asked in the exam. Okay, like you can appreciate two rings here present on the in between this joint. Okay, so in between the bones. So this is about the scurvy. Then this is the fibrous dysplasia. You can see here that the bone shape is somewhat deformed. Okay, so this one is seen findings seen with the fibrous dysplasia. Then moving on to some X-ray skull findings. So first image, you can appreciate here this multiple punched out lesions. You can see here various lesions present, right? These are called as a punched out lesions, also called as a raindrop appearance, and this is classically seen with the multiple myeloma. See here, if image based question is asked, then quite well enough easily you can answer the question. If not, then this can be described in the clinical case about the multiple myeloma, because multiple myeloma is asked frequently in the exam. Along with these other features can also be described of the multiple myeloma. Okay, then moving on to the next image, which is a crew cut appearance. You can appreciate here crew cut or the hair on end appearance. This is classically seen with the hemolytic anemias. This can also be given in the option hemolytic anemia. If not, then sickle cell anemia and thalassemia. If these are given in the option, you can choose this one in the answer. Okay, crew cut or hair on end appearance. Simple one liner can also be asked without giving the image, just giving this appearance, or if clinical cases are asked, then it can be asked given in the clinical case, helping you to find out the correct answer. Okay, then if not, then image will be given, simple image, and they can ask what is the diagnosis. Okay, then moving on to the next image, salt and pepper appearance, which is seen in case of primary hyperthyroidism. So you can appreciate here it looks like a salt and pepper appearance, the skull bone. Okay, then the next image, you can see here cotton wool spot appearance, multiple like this big spots like this. Okay, multiple big spots like this. So this is called as a cotton wool spot. See, I know this is a little bit confusing. Suddenly you cannot differentiate between all these skull bones. So I would suggest you to go through this video 2 or 3 times, look at the images 2 or 3 times, so that it will be imprinted in your brain. Okay, so seen in the Paget's disease. Then the tram track appearance, this is seen in the Stroke-Weber syndrome. Again an important one. I think in the recently, I don't remember which exam, but Stroke-Weber syndrome, this was the question asked. Okay, tram track calcification, this is usually the calcification which is seen. Tram track appearance. Okay, and then in the osteoporosis, you can see here osteoporosis circumscripta. That means due to the weakening of the bones, one part of the bone will be deformed. Okay, demineralization of that part. So that causes this appearance. So circumscripta, osteoporosis circumscripta. So these were some important radiological uh, appearances seen in the skull. So we have discussed some bone deformities, some skull deformity, and again we'll discuss some other important radiological images. The brain hemorrhage is a must know topic because frequently questions are asked on the brain hemorrhages, and expecting a question from this one to be asked in the upcoming exam also, because this subarachnoid hemorrhage, this question was asked in the July 2025 in the recent exam. Okay, so see here the first image. This is the image of the extradural hemorrhage. You can appreciate here, this is also called as a idli shaped hemorrhage. Okay, idli shaped, quite easier to understand. Another important thing which can be described is lucid interval. Okay, so there will be a history of trauma presenting with a lucid interval. That means the patient will be in a unconscious state, then goes conscious, and again goes unconscious. So this is a very uh, what finding about this extradural hemorrhage, which you must note down, because this is usually missed by most of the uh, examiners. But in the exam, this one will be given like lucid interval. Whenever it is given, mark the answer as the extradural hemorrhage. Okay, then the next image, subdural hemorrhage. You can appreciate here, this is called as a lens shaped hemorrhage. Okay, then this is also, there will be given the presenting with the history of trauma. Then moving on to the subarachnoid hemorrhage, you can see here, this is called as a star of death appearance. You can appreciate the star very clearly here, and the classical finding associated with this one is called as a thunderclamp headache, because this was only the question asked in the July 25. Thunderclamp headache or worst headache of my life. The patient will describe something like this, the worst headache. So these are about the subarachnoid hemorrhage, which you must remember. Okay, and then moving on to the next image, intraventricular bleed. So you can appreciate here, these are the ventricles, and in the ventricles itself you can see here bleeding present. Not that famously asked with the FMGE, but yes, you must know about this one. What if this might be asked? Okay, then this one is the parenchymal bleed. Parenchymal, and the most common site in this one bleed is the putamen, and the parenchymal bleed most commonly associated with the patient of the hypertension. And this one is the subarachnoid hemorrhage can be associated with hypertension, can be associated with trauma as well. So these were some important images from the radiology which you must know. If you want a part 2 video on discussing other important radiological images, then comment part 2. I will surely make a video and post it. Okay, so thank you so much for watching this video. All the best for the FMG exam. Okay, and for this PDF and for more free resources, you can join my Telegram channel. The link is given in the description box. You can also follow me on my Instagram channel for more flashcards related to the FMGE. Thank you so much guys, once again. All the best. Thank you.